And hello, and hello. Hi, it is Kathy Frey here, and welcome along to this week's IMCO live webinar. So that's the International Integrative Maternity Healthcare Organisation, and this is part of our maternity healthcare series. So welcome along today to Julie Cottle. Julie, say hello.
Hello. Welcome, everybody.
It's so good to have you here. Julie has presented previously, and I can't believe, we would just say, I can't believe we haven't had this topic talked about before specifically, and that is mastitis, or what is now more properly regarded as the mastitis spectrum, which Julie's going to explain. But just a little bit of background. So Julie is a naturopath and international board certified lactation consultant. So, and she's on a real mission to help women reconnect to their wisdom of their bodies and their cycles, and communities to sort of navigate, you know, that modern motherhood with peace. And we're going to be talking today about the mastitis spectrum. So that's really addressing, you know, lactation-related inflammation from a naturopathic medicine perspective. I mean, you're absolutely kind of that perfect person to talk about it, because one, you're a lactation consultant, and two, you're a naturopath. So, you know, I mean, it's just this perfect, you know, combination of both wisdoms. And so often, I mean, we oversimplify it, Julie, but so often it's sort of like seen as, well, you start off with a blocked duct, and then it becomes mastitis, and if it's ignored long enough, it becomes a breast abscess, which is obviously hideous and a terrible thing to be going through. But, you know, certainly mastitis is pretty common, especially with our primates, those first-time mothers who sort of tend to miss the symptoms, and often you find that the second time round mothers are a little bit more savvy and pick up on it a little bit earlier. But I know that you've got a PowerPoint presentation that you're going to go through today. So do you want to, we'll hand over to you and let you bring that up and do a proper introduction of yourself.
Okay. All right. Bear with me while I get this presentation up on the screen. Oh, hang on.
And of course, for those of you who are live today, don't hesitate to send through any questions for Julie. If you have them, just go into that box at the bottom that you know, says the Q&A link. You can click on there, and we'll make sure that those questions are addressed.
Yeah, please send through your questions. And if you have any follow-up questions that I don't answer during this session, then you feel free to add them to either the IMCO Facebook page, or you can come along to my Facebook page, which is at Natural Transition. But let's get cracking on this. So as Kathy mentioned, we're going to be talking about the mastitis spectrum, which is a collection of different conditions that we've previously thought of as kind of standalone conditions, maybe one sort of feeding into the other, but this new understanding kind of presents the whole thing as a collection of symptoms that's driven by three different underlying causes. So I've called this addressing lactation-related inflammation with naturopathic medicine, but actually what I'm going to do for the first half of this, or the first little bit, is to go through some new guidelines from the Academy of Breastfeeding Medicine. The Academy of Breastfeeding Medicine is an organisation that, among other things, provides evidence-based protocols that are used for the management of breastfeeding by medical professionals generally and lactation professionals, and they're very highly regarded. So this has been a major update to the way that we think about mastitis. And I think that you'll find it really, really interesting if you haven't been introduced to this idea before. So we're going to have a little look through the new guidelines for the mastitis spectrum, and we're going to explore not only some naturopathic management strategies, but also having a look at the new management strategies that have been suggested in that protocol. So, hang on. Can you see the screen properly, or do I have something over top of it, Kathy?
No, we can see the screen properly.
Okay, fantastic. Thank you very much. Okay, so this new protocol by the Academy of Breastfeeding Medicine is referred to as the Mastitis Spectrum protocol, and it replaces the previous protocol for mastitis and also for engorgement. So those two things are now combined into this mastitis spectrum protocol. The mastitis spectrum encompasses a bunch of conditions, and Kathy mentioned before the progression starts generally with some blocked ducts. So we refer to that as ductal narrowing. If we don't get on top of the inflammatory processes at that point, then it is likely to progress to an inflammatory mastitis. If we can't stop it there, then it's likely to progress to a bacterial mastitis. And complications of inflammatory mastitis are phlegmon, and complications from bacterial mastitis include abscesses and galactocele, and we can have recurring subacute mastitis. So that's the spectrum of mastitis symptoms and mastitis conditions. So the new cause of mastitis, or the cause that we now have documented in this new protocol, is that mastitis is not caused by clogged ducts. It's not caused by incomplete milk removal. It's caused by inflammatory processes. So as a naturopath, that's something that I feel fairly confident dealing with. It's something that inflammation is a driver for a lot of underlying issues, and it absolutely makes sense that systemic inflammation can be a driver for breastfeeding related inflammation in the breast, which is working really hard and under a lot of extra pressure, and has a lot of extra vascularization and a lot of extra lymph fluid working through it. So yeah, not surprising that inflammation is going to be both a cause and a driver for moving through this this spectrum of mastitis symptoms. So we know that as well as inflammation, the other driving factor for mastitis symptoms is dysbiosis. So dysbiosis being a messed up microbiota. So too much of the bacteria that is pathogenic and causes poor conditions in the body, and not enough of the good bacteria that's going to be providing benefits to the body. So we know that the first step in mastitis is the narrowing of the milk ducts. congestion and inflammation within the breast. So these are the changes that have been mentioned in the underlying drivers for mastitis spectrum conditions. So specifically what's changed, we used to think that mastitis was caused by milk stasis and bacteria introduced via nipple trauma. So we used to be very on top of making sure that the breast was emptied. We used to ask people to empty the breast. When they started to feel a little bit of pain, we'd say, empty the breast, get the baby feeding. And it was also believed that mastitis was caused by bacteria that came through, say, grazed nipples or chomps or something like that, that it was a bacteria that was introduced through nipple trauma. What we know now is that the causes are hyperlactation or oversupply, dysbiosis or the disrupted breast microbiome, and narrowing of the milk ducts due to inflammation. So Kathy, how does that compare to what you have always known about mastitis as a midwife?
Yeah, that's quite interesting. Very interesting. Yeah, that oversupply is such an issue in that it's such a natural thing, right? You know, that once woman's milk arrives in, you know, they're going to have that oversupply issue going on, you know, for a month or so. And from a baby consumption perspective, you know, I mean, on that day one baby, you know, they might drink 30 mils over 24 hours. And then a month later, that baby's drinking a litre every 24 hours. So I often would explain it to women that it's not that you have an oversupply as such, it's just that baby is going to rapidly catch up with it. So right. Yes, you've got more than you need today, but it won't be the case in 3 weeks from now.
Yes.
Yeah. And, you know, usually we find that sort of, what is it? Really around sort of 5 or 6 weeks, this real supply and demand tends to sort of level, and women don't feel like they're oversupplying. In fact, quite often what will happen is they suddenly start to think that they're undersupplying because they don't have that overfull feeling like they were having. And they suddenly think their milk supply has dropped off, even though their baby is making, you know, 8 heavy wet nappies every day.
Yeah.
They suddenly think I don't have supply. And you're like, no, your perfect supply and demand is just synchronized, you know. So it is such a battle because there's a real feeling that when you've got that oversupply at the beginning, that if you don't express it off, you don't sort of let things just you know, express off enough for a bit of comfort, if you don't do that, you're going to get mastitis. And yet there's that balance between not expressing off so much that you're actually triggering more supply.
Yeah.
And it's interesting that you say that it's kind of the reverse, that rather than ductal narrowing causing inflammation, which logically it does, but we're sort of putting it the other way around. They're saying that the inflammation is causing the ductal narrowing. Yeah. So I guess it's like, how do we get, which you'll come to, I'm sure, but how do we help stop that inflammation causing that ductal narrowing that then becomes that kind of, you know, cascade of problems. And also and it'll be really cool to hear a little bit more about this dysbiosis of the disrupted breast microbiome, because that word microbiome is so topical now, and an area of health, right down to sort of, our own gut microbiome and our vaginal microbiome that the baby gets positively exposed to as it is birthed through the birth canal, and then of course C-section babies don't get that. So there's this, it's such a topical word. It's going to be really interesting to hear more from you from that breastfeeding or breast microbiome perspective and how that all works.
I think we've had a couple of really interesting webinars on the breast microbiome previously. Actually, I hosted one, so that's that would be a really good thing to have a look at if you are interested in this approach. So one thing that I want to mention, so when we talk about narrowing of the milk ducts due to inflammation, so the gross stringy stuff that you can come to sometimes express after that women have experienced as previously as blocked ducts, that stringy stuff is biofilm, and it's actually like it's the processes of inflammation. It's the actual physical left behind bits there that are so in a way it is kind of a clog in the duct, but it's never going to actually clog up the ducts. It's only a very tiny little bit there. The ducts are very small. They're not, and they're not able to produce that amount that's going to actually fully clog them, but they can become narrowed in a way that does impair their function, and combined with oversupply, which can puts a lot of back pressure on the alveoli of the where the milk is produced, means that's actually not able to push the milk out into the ducts. So that whole combination of oversupply and edema and the proceeds of inflammation sort of stuck inside there does make it quite difficult to remove milk from the breast. But the main drawback with not being able to remove milk from the breast is not that it's going to sit in the breast and grow bacteria like we thought before. It's more that it's not going to meet the demands for your baby. So it's going to interfere with that supply and demand, and potentially cause frustration with feeding, as well as obviously pain for mum. So it's something that we definitely want to nip in the bud as soon as possible. All right, I thought we might play a little game of true and false with some of these. So let's start with number one. If I say keep the breast empty with frequent feeding and pumping, is this something that we want to do, or is this something that we don't want to do?
Well, it's certainly something that's been advocated for decades and decades.
It absolutely has.
And it makes me giggle when you've got maybe a midwife who's been a midwife for sort of 30 or 40 years, and literally the thousands of times she would have said that to women.
As a lactation consultant, that's exactly what I've said so many times as well.
Yeah. And then at that same time, that really directly conflicts with that number two, avoid overstimulation and excessive pumping, because so there's always been this thing of like, well, just empty them for comfort level, so you're not overstimulating and creating more supply, but at least you can get some sleep because your boobs aren't just throbbing on you. And also that whole thing about do it in the shower and do it with warmth to help release that and help empty that, dislodge almost that blocked duct, and rub through the lumps. This is I don't know until we finish this webinar today how much of that is right and wrong, but that's certainly been what we've been telling women for a very long
time.
Yeah, not even probably decades, probably centuries.
Yeah. Yes, well, there's no more getting in the shower and trying to massage out painful lumps. We no longer want to keep the breast empty. We don't want to overfeed on the affected side. We don't want to pump from the affected side. We don't want to overstimulate the supply. We want to just meet the baby's demands as much as possible. So we only feed to feed and only express for comfort, and avoid the use of pumps. Because the pump is not going to drain the breast the way that a baby drains the breast. And you're also not going to get the same feedback that you get between the baby's saliva and the breast, which can help with immunological, producing the right immunological factors that the baby might need for environmental exposure to different viruses or bacteria or whatever.
So basically it's saying, no breast pumps for the use of trying to reduce mastitis or potential mastitis. Don't go down the breast pump. Just literally let your baby be the entity that is emptying your breasts.
Yeah.
And then, if it purely for a comfort perspective for the woman, then also if you need to do a bit of hand expressing.
That's right.
Right.
Absolutely perfect. Hand expressing is a skill that is a really good thing to learn as early on as possible. It can be really helpful in a lot of situations.
Yeah, and certainly with colostrum, it is, well, in my experience, is far more effective to express colostrum by hand.
Yeah.
That's just the best way to express colostrum. And then once the woman is in a full milk production, well, obviously if she's, if it's a few months down the track and she's returning to work and that's a whole other ball game when breast pumping will, come into something that's practical, that baby can still get access to breast milk rather than artificial milk. If the woman is not always able to breastfeed that baby. But what we're saying, Julie, is that's way down the track. We're talking particularly that first month where there's the oversupply and a woman and baby dyad still synchronizing and yeah, we're talking about that beginning stage of establishing successful breastfeeding.
Yeah.
And then, once the baby's 2 months old or 3 months old, if you have to go back to work for some hours, then, then head down the breast pump. Yeah.
Yeah, absolutely. So look, and if you need to use a breast pump, if you're feeding your baby expressed milk, then that's amazing. And you absolutely should keep doing that if you're able to. It's best if you can use the pump at the time when the baby would feed and only pump the amount that your baby is going to feed. So it's not the right time to be trying to pump a stash for later on.
Yes.
You want to be just focusing on feeding your baby when if you're entering a stage where you think that you might be suffering from some like early breast inflammation, then you want to get on top of it really fast. And that would be the first thing really to look at is, am I purposefully making more milk than what I absolutely need at the moment, and is there any way that I can now go back and synchronize with my baby? Okay, hot or cold. So this is another one that's kind of turned on its head. We used to
Wow.
advise warm compresses on the affected part of the breast, put it over the sore bit before you feed, and we'd say that that would help to get the milk flowing, and that's what we've always done. We're now saying, obviously, now that we know that inflammation is the driver here, heat brings blood flow to the breast, and that's actually going to increase inflammation. It's going to cause more swelling, which is going to put more pressure on the structures in the breast and impact its function. So you might get reduced milk flow, and often feeding frustrations will result from that. So now we say, did you want to say something, Kathy?
Oh, that is just so fascinating, isn't it? Because we've always known that when there's inflammation on something, that you want to use cold. I mean, you
that's right.
twist your ankle. What do? You put
we know it in every other discipline.
You wrap it in ice, right? That's what you do to reduce inflammation. So that is so fascinating. And of course, we were talking about warm compresses before feeding, but now we're talking about the ice or cold compresses after feeding.
That's right.
So that's totally turned everything on its head.
Yeah. So again, it's just to disrupt this process of inflammation there.
And what sort of length of time are you talking about to sort of give an idea of using a cold compress or ice after feeding?
Oh, look, I can't think of anything worse, quite honestly, than putting ice on breastfeeding boobs.
Yeah.
So I would say to tolerance, but probably not more than 10 minutes.
Right. Okay. Yeah. I mean, and sometimes they, especially in those, that first month when you're in that, even particularly like, that first week, where you suddenly all this huge amount of milk can arrive, and breasts seem to like, from the woman's perspective, they can feel like their breasts have just quadrupled in size.
Yeah.
Like, oh my God, I've never seen my boobs this big. And they are warm and they're hot, they're kind of hot to touch. And that probably that cold compress could feel delicious at some points. Yeah.
It may well.
So there's the putting the cold compress on afterwards makes a whole lot of sense, but is there a situation where people would potentially do both? Like, I don't know, like do the old school of the warm before to like, because it was such an idea that it helped sort of loosen things, and or is it basically a complete waste of time, and it's a whole fallacy?
Apparently, this new protocol says that it's not helpful.
I'm wondering how many decades it's going to take for this new information
I know.
through onto the postnatal wards all around the world.
I know. Well, I can attest that the postnatal wards are still giving the advice for warm compresses here.
Yeah,
it's going to take a while for things to change.
It's a huge mission, and to get that filtered through the system, not just from a knowledge perspective, but from the culture of trying to change the mindset of staff who have been taught that for decades in their career.
And have helped thousands of women through mastitis as well, using what they've known.
Yes.
Yeah.
It's fascinating, and I love this. This is this is what this forum is all about, is this cutting edge knowledge that's coming through. And the thing is, there's so much of what we're learning these days, maternity related information, is stuff that we could not have known about earlier, because we've only in recent times had the science that can study the stuff that we're studying in the way that we are to work out this information. You know, I mean, I know that when I was a research midwife for a while with Auckland University, and the stuff that we were studying, well, there was just no capacity for us to study it before. The science didn't exist. So, and you know, that's the same here, that the more advances we get in science, the more we can learn. And certainly when it comes to anything to do with maternity and knowledge and science, the more we study, the more we realize we don't have a clue. And the more we realize, we go, oh, didn't expect that result, you know, and this particular research study ends up prompting 3 more different studies, because you know, so much of anatomy and physiology knowledge in the world of medicine was based on the male body. And you know what, so we're still getting to know the difference with the female body. You know, it's right down to the simple things like, you know, the symptoms of a pending heart attack are completely different in a woman. And but the textbooks for decades upon decades have listed the symptoms, which are what a male body you know, had. And I would have to say that as a research midwife, it's very clear that the whole area of reproduction has been in sort of almost a scientific too hard basket for a long time. So it's very exciting to start to have, you know, new information like this come into the field for us all to be able to benefit from. That finally these areas of a woman's life experiences are actually getting some scientific focus. Yes.
Yes, it's exciting times.
So cold compresses, oh my goodness, bra or no bra. Avoid wearing a bra and wear a supportive and appropriately fitting bra. Boy, that, you know, that wear a supportive and appropriately fitting bra, that could be just the heading of almost every guidebook on breastfeeding.
It's true. But we did actually used to say avoid bras to stop, so that we didn't put pressure on the lactating ducts, to avoid blockages, so that you don't to minimize like abrasion on sensitive nipples. There are a few times that I've recommended avoiding bras to breastfeeding mums, and I did enjoy a bra-free life as a breastfeeder as well. But the new protocol has specifically said that a supportive and appropriately fitting bra is important to help reduce microtraumas to the breast tissue.
So it's the bra.
Yeah, pro bra, that's right.
Pro bra.
So we used to be no bra, now we're pro bra.
All right. And I mean, when you've got leaking nipples, then for the ability to go to the supermarket without having a wet top, that's helpful. But don't you find that the supportive and appropriately fitting bra can be such a challenging thing to accomplish, in that you know, women buy their breastfeeding bras before the baby's born, and it's such a you know a guesstimate on, well, how and how, what size will you need. There used to be because I used to live in the North Shore of Auckland, and there was a woman on the North Shore of Auckland her whole career was seeing women at 8 months and fitting them for their bras. 8 months pregnant, and look, honestly, she would have just done thousands and thousands and thousands of boobs. And she would always set you up with something like a couple of real good, sturdy, old school matriarch looking bras for daytime use, and she would recommend you get she'd give you a softer, almost sports bra-y kind of bra for overnight. And so it sounds like maybe she was right, and that's because it almost went out of vogue, didn't it?
Sounds like it. Yeah, look, there are maternity bra fitters that you can actually engage online now. I know we've got one here in Sydney that you can do the whole bra fitting online, and she'll send you some things that you can try and return what's not good for you. So I encourage everybody to look for a service like that. Try your bra. Once breastfeeding has established, you may need like a couple of different bras as you progress through breastfeeding. You'll need the one that you get at 8 months that you'll need for the first month or so, maybe. But then as lactation evens out, as it all kind of comes into place, you'll get less engorgement, and you might need a different bra. So you may need to adjust that as time goes, as you go through the process. But definitely keep a lookout for those bra fitting services. And if anybody knows of one, I'd love to keep a little list. Let me know if you've got them nearby, or if you are one of these people, please get in touch with me and let me know, because I want to be able to pass your details on. Okay, massage. Here's another thing. This is another thing that we were always told to massage in the shower, and if you get the lump, you want to be massaging the lump. We don't do that. And now it just seems so obvious. It seems crazy that we ever did that, but you're going to be causing micro traumas to the breast if you're massaging deeply. And those lumps that are in there, breasts are lumpy. First of all, we've got to understand the difference between normal physiological breasts, which can be quite lumpy. And if you feel a lump and then start massaging it, then of course it's going to get sore and it's going to feel like a bruise. It's going to feel horrible. If it is a lump of an inflammation lump, a lump that's a collection of pus or other fluids as a result of inflammation, then massaging it is actually not going to help anyway. It's not going to help to get it out. Sometimes the baby may dislodge a little collection of pus or biofilm from the breast, but it's not something that we actively want to be doing. We don't want to be trying to push anything through or to push anything out, because actually you're just going to make it worse. What is recommended is a gentle lymphatic drainage type massage for breasts that have got a lot of edema, so generalized swelling rather than just in one spot. And to do that gentle lymphatic drainage massage, it's a really light motion, and you're using your hand rather than the fingertips, and you kind of using it just to sort of move the top layer of skin around. So it's not like a rubby massage. It's more of you just want to try and just move that top layer of skin really gently. And we work from inside out. Sorry.
Yeah, so saying moving the top layer of skin, that almost reminds me of that sensation when, say, your hairdresser does a scalp massage. And it's just gently moving that top layer of skin, not doing that whole deep tissue, to say, massage.
That's right. Yeah.
Oh, that's so interesting.
Yeah. So we just want to be moving the lymphatic fluid through, just assisting that that edema to drain via the lymphatic system. So that was a bit of a change for me too, this one. Okay, also no more salt soaks. So there used to be a recommendation for salt soaks. Now we say no.
I'm glad to hear that one.
Oh, you haven't heard that one?
No, I have not particularly, but boy, you'd have to go. I mean, salt soaks would just make the nipples so sore.
Yeah, no, it's definitely not something I've ever recommended, but apparently it was part of the official recommendations before. Now we're saying, no, we don't want to use it.
That sounds
even on cracked nipples. Yeah. I think I have been told, I think I was told as a young mum to clean my nipples with saline. Cracks. For cracked nipples, that kind of thing.
That would be true.
We don't want to do that. I do have a wonderful cracked nipple balm, actually, that I made up a batch on the weekend, and I use chickweed, which is a wonderful anti-inflammatory for the skin. It's used in eczema and different skin inflammation problems, and chickweed's actually used in salads. It's a food, so it's really safe. And I use that in a coconut oil base and add some calendula, and that's my nipple balm. So that's all that's in it, and it's very, very effective. Doesn't macerate nipple tissue.
I've always tended to recommend hypercal, which of course is your hypericum and calendula. Because of just the ease that there's hypercal's so good on perineal trauma, and very good on C-section scars. So it's I guess I've sort of suggested it's almost like a one tube will do it all. I mean, look, it doesn't matter which skin is sore, whether it's your perineum or your nipples, and I would, but again, so you've already got the calendula in. It's because the calendula is the skin healing promoter.
Yes.
Quite often women, there's this whole understanding that antiseptics can be good for healing skin, and that they kill bugs on the skin that shouldn't be there, which is that hypericum part of hypercal. But calendula is the magic secret that, oh my goodness, like if you were to walk into a regular pharmacy and say to them, what antiseptic creams do you have? They'll probably have 10 different brands they can suggest to someone. But if you say to them, what skin healing promoter creams can you recommend? They'll look at you like that doesn't even exist. Nobody seems to know about it. Calendula is the magic thing of helping support our body to heal quicker, our skin to heal quicker than it would without it. It seems to like halve the time. In my experience.
I agree. It's very, very noticeable, and it's great to have even just a calendula infused oil, a little bottle. You can get that. Yes. You can put the oil straight onto the nipple or straight onto any of those other grazes or wounds that need a little bit of extra attention.
It's an amazing product.
It is, yeah.
And it's not a product, it's an amazing thing from nature.
That's right. And actually another way that you can use it, which I did this a lot with my kids when they were little for nappy rash, calendula tea. You can just make up a tea, cool it down, and you can just use that as a water-based appliation.
Yes, directly on the skin, we're telling. Not for the babies to drink it. It's to put it
on. No, not for the babies to drink it. I used to
not that it would harm them if they did, but
spray it on the nappy area.
make the tea and then just put that
Yeah.
on the skin.
Dab it or spray it.
Yeah, fantastic.
Yeah. So the other one that we've got here is no more vibrators on breast lumps. Is that something that you've advocated, Kathy?
I've heard of it, but not something that I personally have ever really advocated. I don't know. It didn't quite. I was like, I prefer.
Yeah. It is quite a commonly used thing. I've had a few patients recently that have that's been their first step towards dealing with a breast lump in breastfeeding. Yeah, not a good idea. And again, because it's going to actually cause little micro traumas inside the breast, it's going to damage the breast tissue. It's going to increase inflammation, and it's not likely to be helpful. We're also not trying to dislodge anything anymore, so we don't need that. What they do now recommend is that you get therapeutic ultrasound from a trained provider, and generally that'll be a women's health physio. And I think that a women's health physio is a wonderful practitioner to have in your field of referrals. I refer on to them fairly frequently for ultrasound therapy.
That's quite fascinating. I think a lot of people may not have heard much about that. Do you want to sort of go into a little bit more detail?
Yeah, so therapeutic ultrasound at the right frequency can be used as an anti-inflammatory agent. It can help to deal with inflammation in the body. I actually used this myself when I had recurring mastitis, and it was actually a game changer for me. It was 3 days in a row, and you do need to go daily. It can take up to 5 treatments for it to fully resolve, but it's a good first offense. So if you do have a women's health physio that does ultrasound therapy, if you do wake up and feel pain, if you feel like it's coming on, like you're getting what we used to refer to as a blocked duct, or you're feeling like you're getting mastitis, get on the phone to the physio first thing in the morning and see.
Oh, your sound has just stopped. Oh no, it's back.
Oh, we right?
Yeah, your sound stopped, but now it's back. So
okay, right. I was saying it's a good first line treatment. So if you wake up with any of those symptoms of breast inflammation, what we might have referred to as blocked duct or mastitis, then wake up, call the women's health physio, see if you can get in for an appointment straight away. And it can be quite helpful for a lot of people.
I could almost imagine with that becoming a bit more of a go-to treatment to help remedy things. I could imagine down the track, somebody developing some sort of, home-held version. Yeah, I mean, like we see that with Dopplers, where women used to just only go, the midwife would be the person who would be, or the obstetrician who would use their Doppler to listen into the fetal heart, and now women are buying them themselves online, which I just want to throttle the companies that sell them, because it's an art to knowing how to listen into a fetal heart. It's not straightforward, especially in the second trimester. And all that it tends to do is make women worry. They're like, oh, I'm using my Doppler at home and I can't hear the baby, or the heart beats too slow. And you're like, oh no, okay, you don't know what you're doing. I mean, we can easily have second year student midwives who are still struggling to pick up fetal heart sounds in the second trimester with using a Doppler. So of course a woman who's never had any training could have some problems. And it's almost like creating those home how Doppler type things that is created a whole little can of worms of more things for women to worry about that they shouldn't be worrying about, which is not helpful to the health of their pregnancy and the well-being of their baby. It's not.
Yeah.
It has a real negative effect when they are that stressed and anxious all the time, which they can tend to be.
Yeah.
But you sort of, do you think, but I guess something, I mean, are there at the moment sort of little home units that women can do themselves with ultrasound, or do they really need to see that physio to have it done properly?
I don't know if there are specifically ultrasound units designed for breast use, but there definitely are home use ultrasound units that you can get for like sprained ankles and things like that. I do have one here, and I haven't actually checked it out to find out whether it would be appropriate for breast. I suspect it would be, provided you put it on the right setting and you use it appropriately. But as you say, there's a lot of skill behind using these things. Physios are trained. There's a reason that people are trained in these practices and these and providing these skills. And if you are able to see somebody that's got the training as well as the equipment, that's absolutely better than doing it yourself.
Absolutely.
Yeah.
So I'm sure at some point somebody's gonna, if they're already available as home-based ones, I'm sure somebody's gonna slap a label on them and call it, you know, your mastitis prevention ultrasound unit that every woman must have in their own home. Somebody will do that at some point in time. But yeah, it's that, I mean, you know, those physios have spent 4 years at university or thereabouts just to get to the point of being a basic qualified physio. They've often gone on, obviously, to learn more into that specialization of women's health, maternity related stuff. So yeah, please use the professionals.
Yeah, that's right. And it's really important that you don't overdo it. I mean, even with a sprained ankle, you have to be so careful about how long you keep the machine on and what frequency you use it at and all that kind of thing.
Yeah,
definitely get a professional to do it.
Good.
Okay. Okay, changes to medications. So this was actually kind of exciting for me as a naturopath to see some of these recommendations come up. So they've kept ibuprofen and paracetamol for inflammation and pain relief. And of course, if you need pain relief to breastfeed, take it. They have also said now to use sunflower or soy lecithin to emulsify the milk and reduce inflammation. Now that's something that I've been saying for, I don't know, 20 years or something. That's been a recommendation there, but it hasn't been an evidence-based recommendation until now. So that's it's great to see something like lecithin come up as a medical in a medical treatment protocol. Antibiotics are now only used for bacterial mastitis. So only when it's confirmed bacterial mastitis, not when it's in that stage of inflammatory mastitis. So if you've got a fever, chills, that flu-like symptom, the sweats, those kinds of symptoms that indicate systemic infection, that's when you use antibiotics. That's when you need to talk to your doctor about antibiotics. It's not recommended anymore that antibiotics are given prophylactically. They're given in that stage where, this might develop into something that's going to be difficult to treat. We actually want to wait until there's a reason to use them. And it's a good idea to get a milk culture beforehand so that you know what organism you're treating and that you know that you're actually treating it with the right antibiotic. So if you do have a woman that has sort of been through mastitis multiple times, keeps getting bacterial mastitis, it's a good idea to send her back to her doctor and ask for a milk culture and to check that the antibiotic treatment that she's using is the correct one.
That's so good to hear, because we just know that there's, for so many things, there's such a terrible overuse of antibiotics, which just increases bacterial resistance to antibiotics, and this whole thing of just hand it out prophylactically, almost, use it as a prevention. We need to not be doing that. And it's so simple to do a milk culture, so yay.
Yes.
It's like, and I think that GPs around the world, our community MDs it is getting hammered home to them that every time they give a prescription for antibiotics, there should be a culture getting taken at the same time. And generally, it might be a case that there's sort of like broad spectrum antibiotics given because there's clear infection, but the culture is taken, 1 or 2 days later, they know specifically which type of bacteria it is, and then ideally take the woman off the broad spectrum and onto a narrow spectrum bacteria that is an antibiotic that is specific to that bacteria. But this whole broad handing it out like candy stuff, it's not good. And just for any women watching this that are not medical professionals, and you're talking about the ibuprofen and the paracetamol. Paracetamol relieves pain and takes down fever. Ibuprofen does both, but also reduces inflammation. And certainly ibuprofen and paracetamol combined are very effective, and they will work on 2 different metabolic pathways. So you're not layering sort of too much drugs on top of each other. They're 2 different sort of ways that they function, so to speak. But here's the thing, is that don't be taking ibuprofen and paracetamol together at the same time. The best coverage is to alternate them, because both of those medicines can be taken 4 times a day, which is, say, 6 hourly. So with any strong pain, be it post C-section or your horrible mastitis, then take turns with it. So every 3 hours you're taking ibuprofen, and then 3 hours later paracetamol, and then 3 hours later ibuprofen, 3 hours later paracetamol. So you layer it that way rather than 6 hourly taking both, and it's just way more effective. So I'm going to throw that hint and tip in. The sunflower or soy lecithin, tell us more about. Isn't it funny how you've been saying something for decades, and then finally the science goes, yes, actually, this is it, this works. So tell us more about the form of that and how you're taking in that, and what sort of doses or whatever.
Okay. Well, the lecithin is it's the phospholipids from either the soy or the sunflower. They have anti-inflammatory properties. You can get it either as the fresh raw lecithin that you can buy in health food stores, is where I would get it here in Australia. I don't know about everywhere else, but you can actually buy it in a bag or in a jar as just the granules. 1 teaspoon is approximately 5 grams of lecithin. So you can use it as a food as medicine, which is the way that I prefer to use it, which is you can sprinkle it on breakfast cereal or anything that you're eating, really. You can put it in a smoothie. So just, a good scoop of lecithin in a smoothie each day is actually just a really good thing to add to your diet, help reduce inflammation. And this idea about lecithin emulsifying the milk I find intriguing. I need to look into the mechanism of how that works, because I don't understand how it gets there, but lecithin is an emulsifier. It's how we use it in cooking. I just need to know how it works in the breast. But as I say, this comes from the Academy of Breastfeeding Medicine protocol. They're very evidence-based, and they wouldn't say it if it wasn't true.
So logically, it must be circulating in the bloodstream, and then I guess cross over to the breast milk through osmosis. I mean, that's kind of how, I don't know, but that's so interesting that they use that word emulsifies. So with the lecithin granules, and you're throwing them into a smoothie, and they say, or on top of salad, or just into some sauce, or I mean, it's a kind of easy way to add them into your diet. But what would be your suggestions on sort of the amount that women are taking as like a prophylactic, just nice daily, routine, versus somebody who is, say, in the middle of some, bad mastitis? What's your suggestions?
About 3,000 milligrams a day is a good, it's a good maintenance dose to take. And it's a very safe supplement. It's a food. You can take up to 5,000 milligrams per day, so 5 grams, 5 to 10 grams even. But 3 grams is a good maintenance amount. And I do prophylactically recommend lecithin to my breastfeeding mums. The other exciting thing in this section is the recommendation to use probiotics for the prevention and for the possible treatment of inflammation. So probiotics is another very good prophylactic supplement for breastfeeding mums. And now we know that these inflammatory conditions, that dysbiosis, microbiota dysbiosis, is a big contributing factor. So probiotics can be a really big help there, and we do have some good evidence-based strains now.
So for a woman's we're talking about her maybe just getting some probiotic yogurt, and she's taking that internally. That's what we're talking about, eating.
Well, this specifically is talking about 2 specific strains,
right? Yeah.
Which I'll get to the details of those in a moment. But just in general, it's a good idea to be taking fermented foods and foods that are going to be supporting the gut microbiota and gut health. Having a healthy gut is important to to reducing systemic inflammation. So the better your gut is functioning, the better your overall health is going to be, and the less chance you've got of developing these problems. So I've taken these changes from the American Academy of Breastfeeding and had a little bit of a look at my own protocols that I've been using to help women with these conditions over the years. And I realized that actually we're pretty on top of we're on top of it. Naturopaths just do tend to, they're always looking at the cause, and we always get back to the gut and inflammation. So it works well with what we've come to know now. So a naturopathic,
it's that whole thing, isn't it? This finally science catches up with what holistic healthcare has been saying for not always decades, sometimes hundreds and thousands of years. And especially when you see things like TCM, traditional Chinese medicine, and Indian Ayurvedic medicine, and they've been using something for thousands of years for a particular thing, and then suddenly science goes, modern science goes, oh, actually that's
Look what
quite
we
good.
discovered.
Oh, look what we discovered. I mean, we just had my husband has just recently had an ophthalmologist, like super senior specialist, eye doctor person who's turned around and said ginkgo biloba would be very good to be taking. It's like, yay.
Yeah, that's fantastic.
Wow, how is it? Isn't that great to hear?
It is. Yeah, integrative medicine is definitely out there. Thank goodness. Okay, so my recommendations: we want an anti-inflammatory and microbiome friendly diet. And I'll give you some more information about that shortly, but it's important that you eat well and that you eat enough. So the biggest drawback with prescribing diets, particularly for breastfeeding women, is it needs to be easy. For a mum with a young baby, it has to be easy, and you have to be eating enough. You need another 2,000 kilojoules on top of what you were eating before you were pregnant, really, to be able to make up the energy deficit that you're going to get from feeding your baby. You need to be making sure that you eat enough food. And
I think that that's often forgotten by women. There is a perception that when you are pregnant, that of course you need some extra calories because you're growing a baby, but then after the baby's born, it's like, oh, they'll try and get back to their regular diet, which is like, no, you need more calories now. I mean, when you were growing a baby inside you, it might have been 7 pounds when it was born, but now you've got a 15-pound baby that you are feeding all nutrition to, so of course you're going to need more. And it does get forgotten in there about that breastfeeding can need a far more a larger calorie intake than a nutrition intake than being pregnant.
Yeah. And if you want to be able to to function at your best, you need to be feeding yourself. You need to feed your body, feed your brain, and only then are you going to be a good carer for your baby. Well, that's not true, but it will definitely help. Okay, so we want to be including whole grains, leafy green veggies, berries, olive oils, beans, nuts, fish, poultry. So these are your non-inflammatory foods, and many of them are anti-inflammatory foods. So helpful to get all of those phytonutrients into your diet. Anti-inflammatory herbs and spices that you can use in cooking: garlic, ginger, turmeric, cardamom, and rosemary are really lovely anti-inflammatory herbs. Now, a lot of people don't like to use garlic, ginger, turmeric, or spices when they're breastfeeding, that they believe that it's not good for the baby, but that's generally not the experience throughout the world. Like, each pocket of the world has their different foods that they believe they need to avoid while breastfeeding, and there's not that many that are sort of universal, and there's none that are particularly grounded in evidence. So, if something doesn't agree with you or doesn't agree with your baby, eliminate it. But don't just eliminate spices just because you think that it's not good for a breastfeeding baby, because I can tell you from experience, babies like curry too.
Yeah, absolutely. And I know that there's some good evidence around the fact that the more variety that woman has in her diet, the more variety then in the flavor of her milk, and there's correlations around those children going on to being less fussy eaters, because right from the get-go they've been exposed to different kinds of flavors. Whereas say, for example, a baby that is 100% artificial milk formula fed, especially when that mother uses the same brand continuously, they can tend to become really fussy eaters because they just never had all that variety. You know, and you can imagine if you was fed the one flavor for 6 months, well, you might reject other flavors.
Yeah, it's understandable how those preferences are developed.
Yeah, and I would always say the same thing to it, like, because sometimes there could be situations where, you know, you have eaten some really amazing, fantastic, hot, spicy, you know, chili filled curry, and that was delicious, and the next day your baby's got this like raw, you know, bit of a raw bum and some more poo that wasn't quite normal, and that's when you I would always say to the woman, look, you know, the best thing to do is not to just make the assumption that you can't eat that every single ingredient that was in that thing, whatever it was that you ate, but it's better just to sort of try them all again and see which one it was or which level of it was that created that reaction that wasn't so positive. You know, don't eliminate everything, just try it again and work out what it was, you know. You might, so
and if you do feel that you need to eliminate things, it can be really helpful to have a talk to a naturopath or a nutritionist about doing a proper elimination diet and only eliminating the things that you need to eliminate.
Yes.
Diet diversity is really important, and the vegetables and the whole grains, they're actually also good prebiotics for the good bacteria that we're trying to grow in our bodies, and a lot of those spices can be as well. So it's actually,
a lot of them are
it's
very
good,
beneficial.
Good to get it all in there if you can.
Yeah.
Probiotic foods, fermented foods like kefir, yogurt with live cultures, pickled veg, tempeh, kombucha tea, probably not the kombucha tea that you get in the supermarket that's got lots of sugar in it, but one that's got a good probiotic culture in it, or without the sugar preferably. Kimchi, miso, sauerkraut, they're all good gut foods. They can be things that you can just keep in the fridge and snack on throughout the day if you need a snack. Pickled veggies are great like that. And of course, the foods that we want to eliminate are the fried fast foods, processed foods, butter, cheese, sugar, and red meat. These are all pro-inflammatory foods, and they're also microbiome disruptors. So limit them as much as possible and pick from the allowed list. Drinks, water, obviously, we want to drink water, but I've put some anti-inflammatory herbal teas in here. Now, these teas, these herbs here, all anti-inflammatory herbs, all herbs that have been used in breastfeeding for many, many generations. Chamomile is used in Western herbal medicine. Wonderful anti-inflammatory, has some pain relieving properties as well, and it's a nice relaxing herb. So that's really important too, to have something that's just going to calm your nervous system while you're going through all of this. Ginger, beautiful anti-inflammatory herb, great to use in cooking, but also makes a wonderful tea. It's been used in the Thai culture for as a galactagogue for a long time now. Turmeric, an Ayurvedic herb, also one of our best anti-inflammatories in our herbal pharmacopoeia. That one's, again, it's given to mothers postnatally. It has been done for a very long time. And licorice is used in Chinese herbal medicine. Again, nice, strong anti-inflammatory herb. It's a lovely sweet cup of tea, and it's often used in postnatal blends. Now, all of these teas can have an effect on the milk supply. These herbs are herbs that are more likely to increase milk supply rather than decrease milk supply, but it can be really variable. It's not likely to affect everybody the same way. So whenever you do start taking any kind of herbal product as a therapeutic agent while you're breastfeeding, you should always watch for unexpected changes in supply. But I would be happy to pick from that list. I tell my mums to pick from that list. 3 to 6 cups of tea a day. It doesn't have to be the same one. It can be a blend. It can be multiple different ones, but 3 to 6 cups of those anti-inflammatory herbs can be really helpful. If you've got hyperlactation, so too much milk, which we know can be one of the entry points for getting into this Mastitis Spectrum, herbs that you can use to help reduce supply would be sage, peppermint, and jasmine tea. And this is where the cold cabbage leaves come into their own. I actually...
They're just miraculous.
They're wonderful.
And the weird thing is that when you take them out of the fridge, most, old schools would know this, but when you take them out of the fridge and they're so perfectly shaped for your breasts anyway, and you put them inside your bra and they feel amazing.
Yeah.
And then they kind of go all sort of limp. And you can put them back in the fridge and they crisp up again.
Yeah.
Incredible. You reuse them again.
Yes.
They are amazing for their sensation of relief.
Yeah, they really are. You just, as Kathy says, keep them in the fridge. I like to pound them and break the veins. So just give them a good, I use my mortar and pestle, but
how interesting. I haven't ever heard of that. That's a great idea. So just so that you get a little bit more of the goodness from them.
Yeah, you want to break the cells and get the phytonutrients out. Look, there's no real evidence to say that does have a topical effect. The evidence is around the fact that you're applying a cold compress to the breast. But as a herbalist, there are additional effects to be had from the stuff that's inside, from the juice of the cabbage.
Topically, definitely. They do something that a regular cold compress doesn't do.
Yeah, that's right.
For sure.
Yeah. So you just keep your leaves in the fridge, give them a pound, put them in your bra. When they start to smell cooked, take them out. And you can put them back in the fridge, or you can go for a fresh one every time. I mean,
it's amazing.
Yeah, they are really helpful. The Academy of Breastfeeding Medicine does specify that ice is preferred over cabbage leaves because of the danger of listeria from cabbage, but you can get listeria from ice as well. So I don't know.
Yeah.
Just be mindful. And of course, as I've mentioned before, we want to watch for unwelcome effect on milk supply. So it might be that these herbs may increase your milk supply, they may decrease your milk supply. If either of those things happen, it's likely to be a transient effect, which means that it's going to stop when you stop taking the herb. So it's not a big deal if anything happens, but also unlikely to be a problem with the recommendations that I've given you here. Only use the sage, peppermint, or jasmine if you really do have too much milk and you want to reduce the amount of milk that you're making. Sage would be the strongest out of those three, and the peppermint would be the one that I'd say go for if you just sort of want to knock it back a little bit. Supplements. So the soy or sunflower lecithin, 5 to 10 grams daily by mouth. I talked about the fresh lecithin before, but you can actually also get capsules, which some people prefer to take capsules, and that's absolutely fine. 5 to 10 grams sounds like a lot, but it's actually, if you're using it as a food, it's really not that much at all.
Well, you're talking about 1 to 2 teaspoons, aren't you?
Really, yeah.
Yeah, yeah. Doesn't sound too much.
Okay. Marine oils, so fish or algal oils. We've come a long way with our algal oils in the last few years. So if you're sensitive to the fishy burps, or you are vegetarian, use the algal oil. What have I done here? But you can take up to 3,000 milligrams a day. I generally advise a mid-range 1,500 milligrams per day, and divide the dose if at all possible. I've made a mistake here on my slide. I did have the amount of DHA and EPA that you want in there, but you need a supplement that's got DHA and EPA in it, and it's actually the EPA that has the anti-inflammatory effect in fish oils. So if you're comparing supplements, look for the one that's got the better amount of EPA. The DHA is what's sort of touted as being good for IQ development for the baby. But the EPA is what's going to give you the anti-inflammatory action. And I put vitamin C and bioflavonoids. It's another just really basic supplement that can have a tremendous effect on the immune system, as well as being an anti-inflammatory agent. The bioflavonoids in there are really help with tissue integrity as well, which will help with the actual health of the physical health of the tissue in the breast. Help to keep the whole system kind of nice and healthy. And the dose on the vitamin C and bioflavonoids, I recommend taking 500 milligrams twice a day. But it depends on the supplement that you're using as well. If anybody does need some extra help assessing their supplements or working out dosages, feel free to contact me on Facebook. I'm more than happy to provide some of that kind of support. And then the probiotic strains, we've got, I've always known this one as L-fermentum. They've changed, names changed, Lactobacillus fermentum, it is now known as, and then the Lactobacillus salivarius, now known as Ligil, I actually don't know, Ligilactobacillus Sylvia, I don't know, somebody's going to have to help me work out how to say that. But that's actually the preferred strain, L. salivarius. But if that's not available, then the fermentum is actually a really good strain as well. Both have got good evidence for breast inflammation, to help with breast inflammation. And yeah, I know that we did have a good a good webinar on the microbiome and on probiotics. So yeah, go back and take a look at that. And just a few other little things here to finish off. And oh my God, I've just looked at the time. We've been going for ages. Women with a history of anxiety and depression experience higher rates of mastitis symptoms. So we want to ensure that we support the 4th trimester well.
Yeah, that's really, really true. Yeah, that's the women, they because they're worrying about everything.
Yeah.
So they have more babies regarded as having colic as well, because they see every cry as being a concern, and they see their so there's definitely a correlation there of their experience. And I mean, we've had lots of webinars to do with the topic of postnatal depression and anxiety and the preventatives around those. But yeah, it impacts just so much.
It does. It does. It
just breaks your heart, really.
It does.
It's so avoidable.
Absolutely. So we really want to make sure that we're supporting postnatal wellness and mood. So I guess with every postnatal woman, we're going to be looking for opportunities to support mood, and if needed, then you need to refer on for assessment quickly. Any kind of stress is going to be detrimental to the microbiome and is considered to be pro-inflammatory. So yeah, it's one of those things that it's foundational. You need to do what you can to deal with that issue before you can really make a dent with the other stuff. Make sure that that your people are getting proper breastfeeding support. If you feel out of your depth, then consider referring to an international board certified lactation consultant who has a good understanding of lactation and the physiological processes that may be contributing to all of this, and may have some other tips for management. And peer support is another really amazing thing that you can use to help with postnatal anxiety and depression and just feeling held and supported. The peer support organisation that we have here in Australia is the Australian Breastfeeding Association. Some really wonderful organisations around the world help your mums to hook into those organisations, help them to understand the importance of being surrounded by supportive, like-minded women that are, you know, they may well turn out to be your best friends in 30 years' time. And yeah, it's good to be on the journey with somebody. And yeah, peer support's been shown to be a really valuable input for postnatal mums. And just to all of the practitioners out there, I just want to encourage them to use all of the tools that they have in their toolbox to support postnatal wellness, postpartum wellbeing, and anything that you've got to address or to help to minimize inflammation and to support the microbiome, then they're the things that you need to pull out to help with the mum that's got any of these inflammatory conditions. I think we're done. Just in summary, I just want the thing that I want you to take away is that the new mastitis treatments are all about decreasing excess stimulation to the breast and reducing inflammation. And that's all we have today, Kathy.
That is so great. And I know that we went over time, but look, it was we needed to. It was great. There's so much information that's been covered off, and that whole decreasing the excess stimulation and reducing inflammation. I mean, that's the bottom line of it. It's that review. Yeah, it's that reverse thinking, that it's not that some blocked duct cause the inflammation. It's that the inflammation causes the blocked duct. It's just switching it on its head and thinking, as you say, of how would you treat inflammation in other situations. You know, when you've sprained your ankle and you use cold compresses, because that's what you're doing, is you're reducing inflammation. Yeah, so it's very exciting to hear of such a seismic change in understanding. You know, that's progress, and that's exciting, and it's definitely going to take a while to filter down onto the floor of you know, postnatal wards all around the world. But yeah, this is great, and empowering for women themselves to realize this, and women who are expectant, who are watching this video, may end up teaching a lesson to their midwife, maybe an old school midwife who just hasn't heard about this yet.
Yeah. Well, refer them to the Academy of Breastfeeding Medicine protocol for Mastitis Spectrum.
So exciting.
Yeah.
And be interesting to see if places like the colleges of midwifery around the world, who are often you know, involved with setting up workshops as, you know, part of you know, continued education. And it would be great to see this, you know, obviously rolled out, this new information rolled out within those, so that, you know, over the next 1 or 2 or 3 years, there's going to be quite a good impact in that knowledge, you know, in the coalface. So thank you so much. And you must have giggled when you read the information, or when you learnt the information about lecithin as being something that's good. When you've been talking about it for a long time, you're like, yes, endorsed, officially endorsed. Okay, well, thank you so much, and thank you those that are here live with us today. And it's always great to have our live audience, and we know that a lot of you are watching things afterwards. Just in closing, Julie, do you want to just go over your contact details as well, if anybody does want to contact you down the track?
Yeah. So you can find me at my website, naturaltransition.com. So it's natural transition, no spaces, all joined together.com. And you can find me on Facebook at Natural Transition. It's the Facebook group is Natural Transition. Do a search for that and you'll find me. I will pop this slide presentation up on the Facebook page sometime over the next 2 days or so. So yeah, swing by and have a look. Maybe I'll start posting some things again soon.
Yeah. So thank you so much. And just want to wish everybody a wonderful rest of their week. And for those of you who haven't met Julie before, she's also one of our very valuable and appreciated volunteers as part of our team here at IMCO. And yeah, so she does lots of things behind the scenes, and we always appreciate that. Mm-hmm. And yeah, so thank you, everybody. And thank you, Julie. And just want to wish everybody a wonderful rest of their week.
Thanks, everybody.
Bye, everybody. Thanks, Julie. See you.
Bye-bye.
Bye, everybody.